Hi, I'm Anupama, a writer, a serial entrepreneur, a mentor, and I run a non-profit for women, Building Bridges Foundation. As a part of my work, I come across many women on a day-to-day basis. A lot of them are in the age group of 40s and 50s, and there's one problem I think everybody faces, and that is menopause. But unfortunately, I think the awareness around it is not as much as it should be. So today, I'm here to talk to an expert, Dr. Jyostna, who is a highly respected gynecologist specializing in women's health. She's going to be answering a lot of questions around menopause, and she will help us understand how we can navigate this phase in a better way, in an empowered way, and can lead to more healthier lives during this phase of our life. So thank you so much for joining us today, Dr. Jyostna.
Thank you, Anupama. That's a very good idea that you've decided to talk to us about menopause. There's so much that we doctors want to tell women, and I think this is a good chance for us to create the awareness.
Absolutely. And I also feel that menopause can be so confusing and even overwhelming at times for women based on my interactions with them. And I think that it's important for us to start from the basics. What exactly is menopause and at what age does it typically occur?
Menopause, as the term says, the time when the menses pause, that is the cessation of menstrual cycles in a woman. And this is usually a retrospective diagnosis that we make, that after a woman has had a final menstrual period and she doesn't have any more periods for a duration of one whole year, that is when we say, oh, this woman has reached menopause. So the typical age for a woman to attain menopause is after 40 years, and in Indian women especially, 47 to 48 is the average age at which women attain menopause. It can occur any time in the early 40s, or it could even go on till 55, 60 also in some women. So we should remember that it's not the same for all women. Some women attain menopause early, some women attain late, but there is a transition period from the time they've had regular cycles till they reach menopause, and that is called perimenopause or the menopausal transition.
Yeah, okay. That was quite insightful, I feel, because we just know of the term, but it was nice to understand about it in depth the way you explained. Now, coming to the symptoms, I often hear of hot flashes, mood swings from a lot of my friends. Now I'm also hearing of, say, acne issues. So there are many things. So if you could just talk about the common signs and symptoms that women experience during menopause.
So from a few years before the menopause, actually the final menstrual period actually occurs, there are a lot of changes which are happening in the female's body. Okay. There is a lot of fluctuation in the female hormones estrogen and progesterone, and the whole problem of menopause is occurring because the ovaries are beginning to get depleted of oocytes, and there is a reduction in the estrogen and progesterone. So when these hormones were there, the body functioned in a certain way, and when the hormones are not there, there is a change in the body. But during this transition phase, when the hormones are falling, there is fluctuation, and that causes a lot of symptoms. So the symptoms of menopause that we usually hear are hot flashes, night sweats, lot of mood changes, depression, anxiety, weight gain, a little bit of skin changes like dryness, increased acne for some and dryness for some. There's a lot of hair fall, and people also notice some urinary issues like burning and itching and a sort of irritation in the privates. And a lot of women also have some cognitive issues like memory issues. They seem to feel more forgetful, or they find it difficult to learn new things. So these are all changes which are associated with menopause, and they occur even before the final menstrual period from a few years in advance.
I think I'm very surprised to know that even I was not aware of some of these symptoms, and I'm sure even the people who are watching, because I'm 42, and it's really like, especially the cognitive issues that you spoke about, I think that was something eye opening. So I think that's why it's important that we have these conversations. You earlier mentioned about perimenopause and postmenopause as well, and even I was not, like I said, aware of a lot of these nuances. Like we hear of the terms, but what exactly are the difference between these stages? Like, because we use these terms loosely, but I think it's important for us to be aware when we come across what stage, and how is it different from, say, a stage of menopause and then post it.
So, as I said, menopause is not one point in time. It is a whole phase in a woman's life, and there is a way in which this hormone depletion is occurring, and the changes are occurring in the
Right.
female's body. So, we, for understanding purpose, we say there is a perimenopause, which is
Right.
an early perimenopause and a late perimenopause. In the early perimenopause, the cycles are not deranged more than 7 to 8 days,
Right.
and they are farther apart and scantier flow, but some women do experience heavy periods as well. But in the late perimenopause, it is more like a 2-3 months gap between periods, and the flow is lesser.
Okay.
And as time goes by, the periods become farther apart, and after the final menstrual period and they don't have any more periods, that's when we call it menopause. Even in menopause, the first few years are early menopause, and after 3 or 4 years we call it the late menopause. So the vasomotor symptoms or the symptoms of menopause, which we talked about earlier, can go on from the perimenopausal stages to the early menopausal stage as well. And the complete depletion of estrogen and progesterone and all the female hormones will cause some long standing changes in the woman in the late menopause.
Okay. I think again that was very insightful to know, and it's interesting how this affects our body in physical ways and mental ways as well. Recently, my mom was talking to me about how she also went through a lot of changes, and she was telling me that how nobody spoke about this during those days. So I think today we have the power of knowledge and power of social media. So I think having awareness is important. So like, if you have to just put this in, like, say, succinctly for the women who are watching, what can they expect when menopause happens in terms of, the physical changes or emotional changes that they go through?
So I agree with you that the awareness about menopause earlier was not as much, and I think because of social media or the internet, now people read a lot more, and when they have some question,
Right.
the information is at their fingertips, so they can gain more knowledge about menopause. But I think it's important as doctors for us also to give authentic information about menopause, about the symptoms, and I would like women to understand that the changes that happen in your body happen very naturally. You have to learn to embrace these symptoms. They are part and parcel of your life and aging. So you will experience some symptoms of initially menstrual disturbances, and later on other changes like the hot
Right.
flashes and night sweats and mood changes, etc. And all these are going to happen over many years. It's not 1 month or 1 week that you're going to experience it. It'll happen over many years. But when you know that this is going to happen, it'll help you understand yourself better.
Right.
And try to modify your lifestyle and your habits in such a way that it eases you into menopause better.
Right.
So mood changes and emotional changes do come as a part of the perimenopausal transition period, and you should remember that they don't last forever. It's just a passing phase. It's going to be there. If it is something like a deep depression and you are unable to help yourself with small changes in your lifestyle, you can seek medical help for it. But usually mild symptoms of depression or mood lability or anxiety can be helped with just improving your lifestyle, doing some kind of meditation or relaxation, and also the stigma attached to
Yes.
seeking help from a psychologist or a psychiatrist when your symptoms get worse should be removed. And you should be open to ideas of meeting a professional and taking help at this time when you know that you can't really help it. It's a natural phenomenon, it's going to happen.
So we spoke a lot about the changes and the symptoms, but now let's talk a little bit about the transition. So while making the transition, what are the lifestyle changes do you think women can make so that that transition becomes a little smoother?
One should remember that even before you have reached the transition, women should pay attention to their lifestyle because someday we are going to reach menopause. All of us know that aging is part of our life, and it's better we understand and embrace it early and make the changes that we would wish that help our body very early, even in your 30s as well.
Right.
So, what I would say is invest a little time in eating healthy. Make sure that you are eating right, a balanced diet with all the nutrients that you require, and cut down on that coffee and tea, caffeine in the evenings especially, because that is going to lead to sleep problems. Sleep problems are one of the first things that's going to hit you when you reach menopause, and if you have good sleep, it sorts out many issues. So cut down on the caffeine, eat healthy, and definitely make a sleep routine. Sleep at the same time, wake up at the same time, and keep close to that on all days so that you fall asleep quickly and you don't have too much of variation in the sleep cycle on different days of the week. So that is important. And the other thing that I would like to emphasize is keeping yourself fit. Keeping yourself fit should become a habit right from your youth, and you should continue it throughout your life, because it's not like I will do whatever I feel like when I'm young and I'll start exercising or walking when I reach menopause. That's not going to help you, because while there is estrogen in your body can keep the bones healthier, it will mineralize faster, the muscles will build, and you can build stamina. Once you are depleted of estrogen, it's difficult to build bone strength. So while you're young and you have not yet reached perimenopause, develop the good habits of exercising and eating a good diet, and through menopause continue it. Having a routine for an exercise, for some hobbies, for relaxation and getting good sleep helps a lot through the menopausal transition. And another thing is, if you are a smoker, please try and quit it as early as possible, because smokers have a tougher time during perimenopause and the menopausal transition.
Those are some great suggestions, and actually I could relate to what you were saying, because I never used to have sleep issues before in life, and suddenly I feel that yes, sleeping properly at a stretch at times becomes a problem, and caffeine, yes, I'm also going to take that tip and cut that down. I think these are very practical suggestions. So along with it, do you also think that certain kind of foods or diet or exercises can also help with this transition, along with the other tips you just gave?
A lot of people, a lot of women ask me about what foods to eat during menopause. Is there a particular food for this, food for that, But essentially, one should remember that a balanced diet is what we're supposed to be taking,
Right.
and cut down on all processed food. Go back to natural food as much as possible. Cooked food, but natural food, and eat more whole grains, more fiber, more salads, vegetables,
Right.
fruits, nuts, seeds, etc. And you should remember that menopausal time is the period when all your digestive issues suddenly increase. You seem to have more bloating and more indigestion, more reflux, and associated with all the sleep issues, they all seem to worsen. So having a really balanced diet and a good diet helps you in the long run. And second thing, you have to exercise, and there is no particular exercise that is perfect for menopause. Everybody has various ways of keeping themselves fit. Somebody who's already into a lot of fitness can continue doing what they're doing. Somebody who wants to start anew also should not be hesitant. They can start slowly by walking or increasing their stamina and then moving on to more intense exercise. You could do a little bit of cardio by walking or a treadmill, or so if you like dancing, you can dance as well. And you should also put some effort into doing weights, because you should build muscle, a little bit of muscle, because after menopause there will be some muscle loss. You may lose muscle, you may gain fat. So essentially you may think you're putting on weight, but you're actually losing muscle as well. So it is important to eat well, eat healthy and exercise. There was some interest for many years about eating soya and foods which contain phytoestrogens. Although there's nothing wrong in eating them, there's no long-term data that supports this concept that taking more soya beans or foods containing phytoestrogen will help actually change some of the perimenopausal symptoms or help you in a very big way. So you can take them, but don't expect a lot of change to happen just by eating foods which contain phytoestrogens.
I think those were excellent ideas for being proactive. I feel that rather than being reactive, if we are proactive about our health, it always works better in the long run. So I think definitely I'm going to keep this in mind, and I'm sure all the women watching are also going to take note of these suggestions, which will really help us in this journey. So a lay person like me hears of a lot of terms. So one thing I've heard of is hormone replacement therapy, HRT. Honestly, I have no idea about what it is. So, but I do know that it's been a debatable topic for many. So, if you can throw some light on what are the pros and cons of it, what exactly it is, and I think that will help women take a more informed decision about these things.
So, what you mentioned, HRT, is now called menopausal hormone therapy. It's basically trying to replace the hormones, the natural estrogen and progesterone, which are supposed to be in our body. We are trying to replace these very hormones by giving pills externally and trying to overcome the symptoms of the perimenopausal transition, basically. So there was a lot of interest in understanding whether replacing hormones will help the women to overcome these symptoms of perimenopausal period, like the hot flashes, the mood changes, the skin changes, the vaginal dryness, etc. And also, will it protect in the long term for the cardiovascular risk, the dementia risk, and any other long term bone strength especially. So this was studied in detail in various studies, and what they found was that women who are less than 60 years and less than 10 years from the final menstrual period are good candidates to seek menopausal hormone treatment if they have very severe symptoms of hot flashes, night sweats, the vaginal or urinary issues, and if they have mood changes, depression, anxiety, etc. They can seek help for hormone replacement. Whereas in the long term, like any risk of developing stroke or heart attacks or bone osteoporosis, bone weakening, and the cognitive changes like dementia or long-term neurological issues, they are not seriously affected by hormone replacement or this hormone therapy. In fact, if you give this hormone therapy for a very long time for women who are beyond 60 or after 10 years of them having attained menopause, it doesn't make any difference to their medical risk, and it poses a danger of them developing clots in their deep veins, that is called thromboembolism. So this risk increases. So for a very long time people stopped prescribing menopausal hormone therapy because there was one big study called WHI study which said that it's more riskier to give. But on deeper understanding of this hormone replacement, it was found that for the right conditions and the right person, these replacement hormones do make a difference, and it is not wrong to prescribe them, but the choice of who should get it and how much time and all that should be decided by a medical professional, and it should not be taken on a whim by patients on their own. There's an important study that came out a few years ago which warned us about the possible risks of menopausal hormone therapy, like increased risk of stroke and blood clots in the deep veins or heart attacks, and increased risk of breast cancer and endometrial cancer if given for very long duration, and other smaller side effects like water retention, mood changes, etc. So it's not a good idea for menopausal hormone therapy to be given to some women who have family history of all these conditions. And although it has all these risks, for most people it is suitable, and you can let your gynecologist decide whether you are a good candidate for menopausal hormone therapy. And for the right person at the right timing in life, when you are less than 10 years from menopause, it may be a very good idea to use menopausal hormone therapy to overcome all the symptoms of perimenopause.
That was very informative, and I think it really helps women, at least, like I said, make an informed decision which comes from a place of awareness. You did touch upon also the bone health while you were talking about the hormone replacement therapy. So, osteoporosis is definitely a concern for many. What do you think women can do again, proactively for working on their bone health and to ensure that they do not have those issues to the extreme that I've heard from many also? So, what is, maybe there can be a few things that they can take care of to sort of maintain a better bone health during that phase?
Anupama, as I said earlier, we need to understand that once there's no estrogen in the body, the bones are definitely going to weaken over a period of time. So while we are still having periods and while the woman is still menstruating or going through perimenopause, it's important that she should invest in good amount of calcium intake through her diet, maybe even take calcium supplements if her diet is deficient in calcium, and also look at her vitamin D levels at regular intervals and replace any deficiency, and ensure that they have a very healthy active lifestyle. Exercise and walking, something as simple as walking also improves your bone health. If you are more mobile, you use your muscles more, your bones will keep mineralizing themselves. When you are inactive and sedentary, your bones become weaker. You eat calcium in your diet while you are young, you mineralize them more, so that when you reach menopause, your bones are already strong and they won't weaken too much after menopause. So, to add to this, there are some women who have inherently weak bones who are more prone to osteoporosis due to genetic conditions or due to some other health related issues. They are women who are good candidates for some medications called SERMs, that is selective estrogen receptor modulators. There are some medications that we can give to prevent osteoporosis and to prevent the risk of weakening bones. Weak bones means you are more prone to fractures. If you have even a small minor fall or a minor injury, you can break your bones. That is the danger of osteoporosis. So to prevent easy fracturing and bone pains and bone issues, you can take these medications, which should be prescribed by a doctor after checking certain criteria. And there are some women who cannot receive any drugs and who are good candidates for menopausal hormone therapy alone. So that also can be explored. But as I said, in the long term, menopausal hormone therapy is not the solution. So starting early, making a base for a healthy bone structure and healthy mineralization of bones in the young age, and continuing to have an active lifestyle later is what's going to help you.
Absolutely. So I think start early, do the right things, eat the right things. And I think your response all the more reiterates why this conversation is not just for the women experiencing it, but who will experience it sometime later in life, and also the ones around her, so that they can also support her and encourage her. We've been talking about natural menopause. But is there something like an artificial menopause, for example, hysterectomy? So again, I think there's somewhere a perception that maybe that is the stopping of the period. So can you shed some light on that?
Anupama, that's a really good question from you. What I would like to make women aware of is removing the uterus is not exactly menopause. Menopause is the last menstrual period. Agreed. When you remove the uterus, you're not going to have periods anymore. But if you have not removed the ovaries, you still have the hormones circulating in your body. So that is not the same as menopause. But you should remember that when you have a surgery such as a hysterectomy, the cause and the reason for which you're doing the hysterectomy matters. When it is not a cancer, usually ovaries should not be removed. And if the reason is a cancerous condition, and that's when we remove the ovaries. So if the uterus is removed along with the ovaries, it is very much like a sudden menopause. And if the uterus is removed and the ovaries are conserved, the woman continues to have the benefit of hormones and she will not attain menopause for many years after that. A natural menopause at the age that she would have had would be the natural course of events for her. She can experience the symptoms of perimenopause, she can experience all the hot flashes and all when the menopausal age is reaching, but she may not have period issues because she doesn't have a uterus. So a hysterectomy is not necessarily the same as menopause. So there is a difference, but knowing that conserving ovaries is important is a big thing, because I know there are some women who feel when you're doing a hysterectomy, why don't you just remove the ovaries?
Right.
Because what if I get some other issue in the ovaries later? I don't want to undergo another surgery. That should not be the criterion.
Right.
Conserving your ovaries is important, and you must try every method to keep the ovaries for as long as possible.
I think that was really crucial to know, and thank you for clarifying that for all of us. Dr. Jyostna, it's been such a delight talking to you. I also got to know of so many things. So, as we wrap up this conversation, what is that one last advice you would like to give to all the women watching, not just maybe the ones who are in 40s or 50s, but everybody, of what they can do to take control of their own well-being and of their physical and emotional health during this transition phase?
Thanks, Anupama. It was a good experience talking and creating awareness about menopause. To sound cliched and to summarize all that we have talked about, I would like to tell the women out there that first thing, invest time in eating well and exercising and keeping yourself fit. And also find some little time to have some kind of an activity which relaxes you mentally. It could be a yoga session or a dance or some hobby that you like. It could be just art or singing or learning an instrument. You don't have to be great at it. You just have to do it so you feel good about yourself. Find that time in your day to indulge in a little bit of hobby and pleasurable activity. And also in all this, you remember that you have to address your health issues on time. Don't delay your little health issues that you come across. And it's not wrong to seek help for all the menopausal symptoms that you face. You don't have to tell, it's all part of menopause, I don't need to see a doctor. That should not be your attitude. You can seek help when you require it. If your day-to-day life is affected by your symptoms, there's no one better than your gynecologist to help you out. So please go and reach out to your doctor. And don't have any stigma about seeking help for your mental health issues. So having some form of anxiety, depression, just mood swings and being irritable all the time are a part of the mood changes that come with perimenopause. And talking it out with your doctor doesn't make you a mental patient, as a lot of people seem to think, but in fact it might give you more insight into your problems. And not all issues need medication. Some of them can be sorted only with behavioral changes. You can do all these relaxation activities and cope with the problems. And also, it will help you cope with the transition better. And once you reach menopause, these mood changes or depression can even subside. So it's just a transient phase, remember that, and seek out help. So all these, I hope these advice help you in combating the changes of menopausal transition, and have a healthy life. That's all I would like to say.
Those were extremely helpful advice, like all the things that you shared. I think women, please make a note. So Dr. Jyostna, thank you so much for your time today. I think the insights that you shared were brilliant, and you just made menopause, I think, so much more clearer for all of us. And I'm sure a lot of women who are watching this, this will resonate with them, and this will help them to navigate this phase more easily. And I think it's a great example of also empowering women, because when we share the right knowledge with them, I think that's a great start to women empowerment, which we all talk about so much. So thank you once again.
Thank you, Anupama.
For all those who are watching, if you need more personalized help or if you have more questions, don't hesitate to reach out to a healthcare provider. And don't forget that you are not alone in this journey. Stay informed, stay happy, stay healthy, and most importantly, be kind to yourself as you navigate this time. Thank you all for tuning in, and don't forget to follow us for more such insightful conversations on women's health in Ankura's Edu Talks.